Good evening, everyone. Welcome to Restoring Hope with Crosswinds Counseling. I'm your host, Curtis Smith. Thank you so much for joining us tonight. And as always, a huge thanks to the community partners who make it possible for us to be here each and every week. Prime 47 Downtown, Tesco, and Shepherd Community Centers. The support of these incredible companies makes it possible for us to be here every Thursday night on WHMB TV. Every week, we hear from Crosswinds counselors on a variety of topics, but occasionally we have the privilege of sitting down for an extended time with a counselor to get to know them a little bit better. And tonight is one of those times. Phil Erichsen is here with us tonight. Phil, thank you so much for joining us.
Thank you for having me today.
You're a counselor at Crosswinds Counseling.
Yes, I am.
Tell me a little bit about your life as a counselor. What is it like to be in the counseling world these days?
These days, oh boy.
Right?
I often get asked that a lot of times, what's it like being a counselor? And it's funny because I think, usually when we're at an occupation where we feel we're kind of gifted and placed to be, it just feels right and feels natural. I love being a therapist. I love helping people. I love kind of being a guide wherever they're wanting to go. I believe it or not, I enjoy, as crazy as it sounds, enjoy going into the mess and the things in people's lives. We all have stuff that we all have to work through and deal with, and someone's got to be out there that likes to do all that and hear about that. I have no problem with conflict or stress or even sadness and hurt. I'm able to be right there and sit with them and just try to help them and guide them through as best I can.
You said something I think is so true. We all have stuff. We all have things that it's helpful to work through. Yep. Have you, and we've talked a lot here about the stigma, how the stigma of going to counseling can stop people, prevent people, cause people to freeze up. And it sounds like that's generally getting better. Do you still deal with that to some degree, or do you think it truly is getting better?
I think it's significantly better, at least compared to something like, say, like 20 years ago or something like that. There's still some difficulties that people have. Sometimes there's family members or folks in, let's say, older generations or things like that. Sometimes church folks can struggle with it sometimes. If specifically, I know currently adult men tend to struggle with coming to counseling because they think when they come to therapy that someone else is going to tell them what to do. And we tend to feel like we accomplish something on our own. Now, my job is not to tell people what to do. That's not at all what I do. In fact, I usually ask people what are their top 3 goals that they want to work on in counseling, and I set that down as like a concrete thing, at least in the beginning, and refer back to it, but use that as a guide to where they want to go. And then check in with them every couple sessions and see if there's been progress or any direction that they want to change or veer, go different. So, but in terms of therapy and that stigma, I think it's not as bad as it used to be. In fact, one of my favorite assignments to give people in counseling is asking friends for help. Hey, my therapist said, hey, would you be willing to help me out with this thing or this? Or they'll ask them certain questions, usually perspective questions about how their friends view them or their support system views them, how they resolve their conflicts. And it's funny because people are very, very, very willing to help others with their counseling assignment. I think it's because they just, want to help someone that they care about, and especially if a therapist suggested it, they're like, oh yeah, I want to be a part of that and help out.
Yeah, that's a great way to get the stigma to go away, to have them just casually talk about it.
Yep.
I know you work with individuals and couples and families. Do you have a specialty, or is it kind of all over the board in terms of who you work with?
If it were a specialty, I work mostly with marital couples. I'm a family therapist as well, so I work with kids and parents, usually all together, try to get everybody on the same page.
Yeah.
So if there were anything that I really specialize in, I'd say mostly marital counseling.
And topic-wise, are you seeing things these days from people or families that you didn't see 5 years ago, that weren't such big issues 10, 20 years ago, have really bubbled up more in our society today?
That's a good question. If I were to actually pick something, I think the struggles with electronics have definitely increased. Our reliance on them, and not just for kids, but parents, and how much screen time how much intake we have with it, even to the point where people have difficulties falling asleep. To, as parents, how do you manage that screen time when, especially during the pandemic, and at least the more stressful parts of it. The screen time for kids, I mean, it was, how many hours in a day? I mean, like upwards of like 8 to 10 sometimes, you know, because of school, and then also their fun things they do. So I think that's one that's kind of the newer one that's harder to balance and cause a lot of stress and sometimes confusion.
Let's talk quickly about working for Crosswinds Counseling. I know you love this organization, and I know that you've invested so much into it, and vice versa. What is it about Crosswinds that you like so much?
Honestly, we feel like a family. I know and get close to practically all the therapists. I know that if things were to become difficult, that I know that my coworkers are people that I could rely on and count on, and we'd go out of our way for each other at any point in time. I've had someone watch my kids at different points in times, and we're always willing to have a listening ear and help each other out in terms of sessions and things that we're dealing with in our personal life. It's just a fantastic environment. I don't think I'd ever be able to find an environment like Crosswinds if I tried to go elsewhere. So
that's awesome.
I'm not leaving nowhere.
Yeah, good. No, that's good. The need for counselors and therapists is higher than it's ever been. If you could go back and give yourself advice as you went into school, or if you could speak to someone who's maybe in high school or early in college and not sure exactly what they want to do, but thinking, man, I could be a therapist, what advice would you give to a younger version of yourself or someone today in that same boat?
This is the most common advice I will give anybody, especially if they're going to go into this field that they plan on going. So either just graduating high school, about to graduate high school, or just starting college. I let them know that you most likely will need at least 6 years of college. You'll need your master's degree to do the one-on-one counseling kind of like this.
Yeah.
And so, if you think you only need 4 and then you surprise, junior year of college, oh, I need 2 more years.
Right.
That might be a little bit of a shock.
Yeah, right.
And something that you probably want to at least plan for. So I let them know that so as they know what they're getting into ahead of time.
Great advice. Phil, thanks so much for spending a few minutes with us. It's such a benefit to us. We hear from our counselors, but to get to know you a little bit better, we really appreciate the time.
Thank you very much for having me.
We'll be right back. Welcome back to Restoring Hope with Crosswinds Counseling. I'm Curtis Smith. Tonight we have a very special guest with us. Dr. Luke Neliigan is the chair of family medicine at Marian University. He is here with us tonight. Dr. Neliigan, thank you so much.
Curtis, thank you very much.
Tell us a little bit about Marian University, family medicine. You helped start this entire program. Tell me about what's going on there at Marian.
Well, Marian is, we've had a really successful year this year with 99% placement of our graduates.
Wow.
Vast majority go into primary care. And they'll be dealing with people's life events from a primary care standpoint, either OB-GYN or pediatrics. Many go into family medicine. We've had some people with general surgery, so the predominance of our students try to practice in Indiana or train in Indiana. But we have a lot of Midwestern kids that come from all around, and we had about 57% of our class were from Indiana as a private school. That's pretty great. And they hopefully, like you say, will get out and treat people on a primary care level for years to come. So.
You've dedicated your life to medicine and to helping people. I would imagine these last 6 or 7 years being the chair of this department for Marian has been slightly different for you. It's been an eye-opening experience,
sure
probably in many ways. What has that been like? Not a transition, but an addition to your career at that stage 6, 7 years ago?
It really was interesting. We, as a guy that tried to start the school, there was a need. 54 counties out of the 92 are underserved. So we said, hey, IU is a great school. They put out tremendous physicians, but obviously there's something else we need. So we, as osteopathic physicians, we're primary care based. So we came in there, I did some administrative stuff. I was brought on as chair of family medicine. I did some other administrative things. And then COVID hit after a couple of years, and then we had to go to online education and try to adapt our curriculum really at a month's notice and come up with a good educational experience for students that would meet our accreditation standards, but also provide them with the information they needed to become great physicians. And I actually formulated an online psychiatry course for them during that time, and we dealt with the students' anxieties and depressions, and then also gave them hopefully the tools to transpose from that psychiatry course how to treat people in the primary care setting. So I think we got pretty good reviews. The students did well on their comprehensive exams for that month, so I feel pretty good about it. But it really, the whole COVID experience for all of us has been a game changer for everything, really.
Yeah, for sure. On the private side, you've been in medicine for a long time. What areas do you specialize in? Where have you practiced? Tell us about your career outside of higher education.
Sure. My lovely bride Carol's from Indianapolis. We met in Philadelphia at a party through some mutual friends. And then I moved to South Bend in '94 when I graduated my residency in family med. Spent a couple of years up there. Being a Notre Dame fan, I had to experience it for myself up there for a couple of years. And then I came to Indianapolis, where my wife is from, and I've worked at Westview Hospital, which is no longer exists, and I've been in private practice. And as a result of that, I got into hospice and palliative care. So I have 2 certifications, family medicine and hospice and palliative care medicine.
Those areas certainly bleed over into something we talk about here all the time, mental health and restoring hope. When you're in the hospice palliative care space, I'm not even sure the line is so blurry. I'm not even sure you can see the line anymore. Would that be a fair assessment?
Yeah, I think it's very fair, Chris. We have people that are experiencing grief and anticipatory grief on the family members. So people go through the stages that Kubler-Ross really describes, but also they're going through anxiety and depression as they see that their health is slipping, or a family member witnessing the decline of their loved one. There's a lot of depression with the family, and we have chaplains that help counsel them, and we help recommend, because we're treating the patient that has a terminal illness, but we can recommend that the family members seek some help and counseling. And the chaplain services really help a lot for people, and it's non-denominational, so regardless of what religious background you are, or if you don't have a religious background, they can help you out as well. So that seems to be a good sounding board for a lot of people.
Speaking of grief and mental health, the need for mental health services, you have seen some pretty shocking things over the last couple of years in terms of how the pandemic has played out, how it's impacted the population at large, but even young people especially.
Yeah, I mean, the leading cause of death for people 18 to 45 is overdose. And people are using these illegal drugs, right, as a way to change their state, the way they feel and how they deal with the reality that's upon us. And none of these people decide to say, I'm going to get involved with this drug and then die from it. Most people don't want to do that. But they want to change their psychological state. And so a lot of people are turning to that. Adults, too, liver failure and liver diseases are on the increase because of by 25% between 2020 and 2021. And the reason being is people are turning to alcohol to self-medicate, which is very, very available. And many times was one of the few essential businesses that was allowed to really perform and stay open during the whole pandemic.
Right. So I know there's no quick fix to a problem of that size and that scope, but what can we do as a society to right the ship, to help these just large segments of the population going through these struggles?
Well, I think there's a lot of great programs that the state of Indiana is trying to do and provide cash for that, but we really do need healthcare providers, from nurses to psych nurses to counselors, psychiatrists, and all that, and then even most psychiatric treatment is really done at the primary care level. So if we can get more and more people to get into the primary care trenches, so to speak, PAs, MPs, DOs, MDs, to go and do that, I think we can have an impact with that. When you apply the physiology, when people have neurotransmitters that are out of balance and diet may be off or they have other concomitant medical problems, if you can get people to look at it holistically and try to give them what they need in addition to counseling services, followed by exercise and diet. I mean, when people are depressed, their serotonin levels are usually down. There's certain dietary foods you can take to help increase, tryptophan is one of them. Exercise has been shown to raise dopamine levels and serotonin levels, and sometimes as well, or if not better than certain, commonly prescribed antidepressants. So,
give us a quick word of encouragement about people in their 20s. I think as we all get older, we look at the younger generation. with a jaded view. You're around kids a lot.
Yeah, I am. They are kids.
Yeah, encourage us with what you see in that population.
I really do feel that they are going to medicine for the right reasons. I do. The students that we have at Marian, they have their ability to demonstrate empathy is really at an extremely high level. And I do feel that we give our students a great primary care education. So not only are they getting the necessary skills academically to understand the science and to understand how to actually treat somebody from a medical standpoint, I think we kind of attract some students that are really interested in service. Marian has, the Franciscan's values, and the dignity of the individual is one of the four. And our students really, I think, regardless of what educational or religious background they demonstrate that pretty well.
That's wonderful. Dr. Luke Neliigan, thank you so much for joining us.
My privilege. My privilege. It's appreciate the work and the mental health information getting out to the public.
Well, thank you. Appreciate your time. We'll be right back. Welcome back to Restoring Hope with Crosswinds Counseling. Earlier, we got to visit with Phil Erichsen, and now in our Counseling Corner segment, Elaine Awayinka joins us to share her thoughts on dealing with something we all feel from time to time, anger.
Hi, my name is Elaine Awayinka. I'm a therapist with Crosswinds Counseling. Today I'd like to talk about anger. Anger is characterized by antagonism towards someone or something that you think has deliberately wronged you. Anger can be a positive thing. It can be a way to express negative feelings or motivate you to find solutions to problems. However, excessive anger can cause problems with difficulty thinking or harm your physical and mental health. So what can you do? Control anger before it controls you. Problems can occur at home, at work, in personal relationships, at a specific person, worrying about personal problems, memories of a traumatic event. The instinctive, natural way to express anger is to respond aggressively. It's a natural adaptive response to threats. These responsive feelings and behaviors allow us to fight and to defend ourselves when attacked. And a certain amount of anger can be helpful. There are three main approaches to anger. First, when done assertively, is expressing. This is allowing yourself to make your personal needs clear, how to get needs heard without hurting others and respecting others. The second is suppressing. This is the hold in anger. Stop thinking about it and focus on something more positive. The aim is to inhibit your anger and to be more constructive. The danger is that anger can easily turn inward. Anger turned inward may cause hypertension, high blood pressure, or depression, resulting in unhealthy relationships. The third is calming. This is controlling behavior and internal responses. Take steps to lower your heart rate, calm yourself down, and let the feelings subside. There are several strategies that you can use. There's the relaxation techniques such as deep breathing, relaxing imagery, non-strenuous exercise, any way to take steps to lower your heart rate and calm yourself down. Cognitive restructuring is a different way of thinking, problem solving, humor, better communication, and changing the environment. If you feel that your anger is really out of control, is affecting relationships or other parts of your life, consider counseling to learn how to handle it better. Remember, control anger before it controls you.
Welcome back. Each week here on Restoring Hope, we focus on the word hope. Tonight in our Beacon of Hope segment, Crosswinds Executive Gordon Haynes focuses on that very word and shares his insights on having hope.
Hi, my name's Gordon. I'm a member of the Crosswinds executive team, and tonight I want to talk about hope. I looked up the definition of hope in Webster's dictionary, And it's defined as to want something to happen or to be true, and to believe that it can happen or that it can be true. Now, why do I want to define what hope is? Because, well, briefly, I want to talk about what's the impact of hopelessness. When people are hopeless, there's an increase in violence in schools, there's an increase in domestic violence, there's an increase in anxiety and depression, self-harm, addictions. It just is a real negative for our society. Now, the reason I say this is there is reams of research, and I'm not going to quote a lot of research tonight, but I do want to share some with you because I looked it up. Do you know that hopelessness leads to unhealthy moods? And if you have an unhealthy mood, then your view of yourself, the people around you, and society around you is very negative. And those negative views impact how you live your life. You couple that with the fact that Pew Research says kids in America, in fact 70% of teens between the age of 13 and 17, are seeing increased levels of anxiety and depression. Now, none of this information brings you hope. I'm sorry for that, but there is good news. There are also studies out there that say hope can be taught. And when people choose to be hopeful, or people are taught to be hopeful, guess what happens? They have better academic performance. They're happier. They're living more fulfilled lives. There was a study by Snyder that said people had enhanced personal relationships and much more fulfilled lives. There was another study by Rand and Chevens in 2008 that determined that the greater the hope, the greater the level of well-being. Hope is a choice, and we can learn to be hopeful. So if you're someone that is without hope, I hope that you get help and learn how to be a hopeful person. I personally am a follower of Jesus Christ, and I find hope in my faith. There's a verse that I live by. It's Luke chapter 1, verse 37. I'm going to paraphrase it. Basically, it says, faith does not make things easy. We all know life is not easy, but faith makes things possible. That gives me hope. You know, we can't choose the circumstances that we live in, but we can choose how we react to those circumstances, how we view those situations, and what actions we take to turn those situations into good situations. I hope you find hope.
Thanks, Gordon. Wonderful thoughts, as always. With that, our time is just about up tonight. A quick reminder to check out crosswindscounseling.org/careers if you'd like to join the Crosswinds family. Thanks again to our sponsors, Shepherd Community Center, Prime 47 Downtown, and Tesco. And of course, thanks to our friends here at WHMB TV 40. We'll see you next Thursday night at 9:30. Stay safe and be blessed.